on the TCHC website, and know that the process of the housing assessment form and the VI-SPDAT, this prioritization system, will be a part of the basic new HMIS user training. So exactly what is the HAF? The HAF is the Housing Assessment Form. It's essentially a uniform assessment tool that was developed by the Homeless Coalition in cooperation with agencies and the Planning Council. It's a survey, it's a questionnaire, and it asks a lot of key questions so that we can interpret some of the significant barriers and challenges of our clients to make sure that we match them with the appropriate level of service or housing intervention. The new HAF system will produce two things. It'll produce a menu of possible services through a series of messages that may assist the client based on the answers to some of the questions. It also will reproduce a VI-SPDAT Severity of Service Needs score. You remember we used to have the vulnerability assessment survey that was used primarily by Directions Home. This is similar to that. And these are in compliance with the new prioritization system, coordinated access system, that was put into place by the COC Board of Directors when they adopted the new standards, and now we are going to put into play those policies and procedures as a method of prioritizing our clients for our housing resources. The VI-SPDAT Housing Assessment Form, we're going to be calling it the HAF. I've put some information here about the history of the VI-SPDAT, and it is literally one of the instruments that was mentioned by HUD in its notice on prioritization of clients. It has been a tool used by many communities, Community Solutions, the 100,000 Homes campaign. The Planning Council sat down with TCHC staff and we looked at some of the options, and it was adopted by them that they wanted to go ahead and use this tool that had a lot of utilization around the country, produced a well-understood score, and its purpose is to say that persons with the highest levels of severity of service needs should get those intense interventions that we provide through our permanent housing programs. That rapid rehousing for those that had just a moderate level of service need, and then those that just need affordable housing. They don't really present with any significant health or mental health barriers. They may have just lost a job and they just need to get reconnected, reaction to maybe an eviction or something like that. Something that is really about it, just sheerly economics and not having to do with other particular more deep-seated barriers that are going to take some of the interventions of our case management staff. I've got some sources there that you'll be able to click on when you get the archive version of this PowerPoint if you are interested in looking at some of the ways it's been used and how it was developed. We actually have a complete copy of the VI-SPDAT in a PDF format so that it mimics exactly how it is in the HMIS system. And I put this link here so that after the broadcast you may want to go and you can take a look at it. It's like a 50-page document because anytime you convert to PDF something that is in the HMIS, it tends to produce a lot of pages. But it is also out there for training purposes. So step one when we're looking at our clients is they need to be a client that is actually in the HMIS system already. Most clients who are presenting as homeless are going to enter through the emergency shelter stream or perhaps through street outreach. So those clients that are already in permanent supportive housing, already in transitional housing, and already in rapid housing do not need to have a HAF done, don't need to go through the process. They've already accessed housing, unless of course they have been exited and they are once again have returned into the emergency shelter system or returned back out as unsheltered. You may want to go ahead and get them reclassified so that they can have access to housing if re-entering into a supportive housing program is necessary. Some transitional housing clients, we may also want to have a HAF done. Note that there are many programs that clients who have been in transitional housing are no longer eligible. Some programs will allow that if they had already been in an emergency shelter or unsheltered prior to. So some transitional housing clients you may very much want to go through the HAF process if they are not able to self-resolve, and permanent housing, they have not been able to identify that because they have been presenting with significant barriers. I'm thinking of some of the veterans in the GPD programs, Simon, the Salvation Army program. So those programs where there isn't just a sure permanent housing exit because of barriers, I would suggest that you go ahead and those clients also conduct the HAF process. You always want to make sure before you go through this is that the client is already in the HMIS system. We remind everyone in the new HMIS training, before you ever add a client, make sure they're not already in the system, because then all you're wanting to do is perhaps conduct a new touch point, make sure that you record a new service. So make sure that is done. And if there is a client already in the system, and you see that they have already had a housing assessment touch point, you might want to, you would not want to update one until it's at least 90 days old. There is within the system, we're saying do not update a HAF within 45 days, but for the purposes of the attrition, if you're coming across a client that's been served by another agency, their existing HAF and their existing prioritization status should hold for at least 90 days. If it's a brand new client, then you need to make sure that you go through the standard process of a HUD assessment touchpoint. That's the entry, update, annual, or exit, because that assessment tool that is standardized across the continuum collects much needed demographic information that will be pre-populated when you actually go in to conduct a HAF assessment. So the first thing in conducting the VI-SPDAT HAF survey, I want to kind of walk you through what that touch point looks like. It has 4 workflow tabs. The third one is only for unaccompanied use. So most of you in your application are going to be walking through 1, 2, and 4. So once again, a reminder, make sure that there is already a HUD assessment, entry assessment done and on this client so that you've got the demographic information necessary. So I had Alexandra, she printed off a bunch of screenshots of what it kind of looks like within the ETO HMIS system. And so here I have circled in red what that workflow is. The one that we're using right now is a fake client that they put in so you can see the order of the questions. The VI-SPDAT is the first part of the workflow. And you see that these scores, as each question goes down, you can see that it's a pre-screen score. And as you're working through the questionnaire, through the survey, you begin to add scoring items, 0 to 1, depending on the information that is provided. And it has different pull-down menus. So it works through age, so that which will come through the demographics. It'll walk you through some history of housing and homelessness, some socialization, daily functions, wellness, different conditions, and you get this pre-screen total. The score goes anywhere from 0 to 18. A score of 10 or greater indicates that the client has a high severity of service needs where it would be very appropriate to recommend different types of permanent supportive housing. A score of 5 to 9 is a less severe service needs, but still presents that there may be some rapid housing programs or other programs where there is case management involvement. A 0 to 4 indicates that they're really not suitable for a COC housing, full housing subsidy, other community resources, direct client service fund, housing placement services, homeless prevention, and much, much less case management requirement. You're just trying to move them along. They don't present with a lot of severe service needs. So that's part of the scoring mechanisms. And so here you can actually see these questions. And again, the complete and comprehensive survey, the VI-SPDAT, the Housing Assessment Form, Unaccompanied Youth, and the report are on the TCHC website. And each of these categories will walk you through, and you will see a score based on the response. Socialization and daily functions, socialization, daily functions, and you can see that the score escalates based on some of the response. Here are the wellness questions and the scores. Now, one of the valuable items of the VI-SPDAT compared to some of the prior tools that we use in our continuum is that there are certain times the client may suggest and there are some observation things. The case manager really has a role to play in the survey process and observing the client, observing the health, where the observation of a skilled case manager comes into play in giving a true evaluation of the client's severity of service needs. And so there are questions where there are going to be by observation so that we can make sure that there is really a thoughtful assessment of the client's needs. And before you hit down here, I wanted to look, and so this fake client that we've gone through and picked certain questions had essentially one of the highest levels, 17. The highest is 18. If there is a based on trimorbidity. And so this gives you an idea of what that score. And right here it says client has a score of 8 or greater. I modified that, and it's 10, being consistent with the VI-SPDAT manual. And that's how we're going to start in our continuum, is using exactly the model that was printed in the VI-SPDAT, so that we're using the same model that is also used in other communities for comparison. Now I want you to notice that this says pre-screen score, and that is the language of the VI-SPDAT, but that is also important in our work in assessing a consumer's need and matching them to a housing intervention, because this is not the only variable that we're going to be using in the housing process. There's other variables that may be dependent on actual funding and grant program eligibility. Priority status is also based on length of stay, documentation of disability, whether or not the disability or chronic status is actually established through documentation. This is just one tool. So this is just a pre-screen to really identify the high severity of service needs right off the bat to help guide the case manager into the type of housing interventions that may be pursued. The second tab of the workflow is the housing assessment form. Again, this is an instrument that was developed locally, that it has been modified because there were some questions within the VI-SPDAT that were duplicative of the housing assessment form. So those have been removed so that as you're walking through the workflow, we're digging down into some new questions. Again, some of the questions on the HUD assessment form will be pre-populated from one of the HUD assessment touch points that may have been done prior to this time when you're sitting down with your client. Several of them are conditional, the questions. If the client is a veteran, you're going to be prompted to answer a few more questions about discharge status and service. Whether or not there are an adult that is unaccompanied, a single, or some with the family, additional fields will open up so that you're getting a lot more information about the family in the situation. Contact information for the case manager, lawyer, probation officer, other information that can be very valuable in assessing the opportunities and the barriers of the client are also included in the housing assessment form. So here we are moving through, and you can see some of the pre-populated areas about the housing assessment form. I'm going to go ahead and walk through some of the screens. What Alexander has indicated with the red is that there are different things where there's a pull down where you are going to be perhaps changing some of the pre-populated data where you want to update. And these are components that give us an idea of what might be necessary in types of services for the client. Household type information, criminal history, the different thing, and if there are other persons in the household, this gives the opportunity to add those family members and provide different information related to those children under 18 in the household. And again, contact information or other information that might be necessary and helpful. And each of these pages will have a prompt for the next page. The fourth workflow tab is the HAF report, and these are just some examples of messages that might appear based on some of the information that was gleaned from your questionnaire. This information here right now is based on the latest information provided by agencies. Now, one of the things that was important to the Planning Council when we developed this HAF and VI-SPDAT is there are some special conditions that were determined, especially where there are children involved, a woman who is pregnant, that we needed to show that even though the VI-SPDAT score may have not been that high, because of certain special conditions within that household, that there could be special considerations to know that you can't just go by the priorities of the severity of service needs score. Maybe it's a 4, but there's some other mitigating factors that really were not gleaned from the VI-SPDAT score that should be considered in providing a higher level of services, perhaps even a more intense housing subsidy because of those conditions. This tool is going to give you that flexibility when you're moving forward to try and document. Now, I sent out an email last week asking each agency for a designated coordinated assessment system contact. Just to keep the communication flow easier, each agency was to provide 1 or 2 persons that we will go to for many aspects. 1, updating messages referral phone numbers and how those messages should appear based on a housing resource that your agency provides to make sure that when someone conducts the HAF, hits the report, that the information that is provided is accurate and that there can be some result or a positive referral from those messages. They will also be involved in maintaining the priority housing list for the agency for clients that are within your agency, or communicating any availability or lack of availability of resources based on funds running out or housing turnover. Documentation of priority status. There have been multiple trainings. This is where case managers get all their documents together and email Mario Puga, mario@ahomewithhope.org to say, I want to request you to prioritize my client. There is no change in that process. The change is in the priority levels. We're going to go from priority 1, 2, and 3 and no priority to priorities 1 through 12 and 2 levels of non-priority. Again, this is the process. It has not changed. The case manager seeking housing solutions for a client has gone through the housing assessment form. Now has, in addition to this HAF report, has that pre-screen score. That touch point is recorded in HMIS. It must be done before the DOPS process because Mario, the Coordinated Assessment Office, needs to see that score as part of its prioritization process. All the documentation, if it's there, needs to be gathered and attached to the critical documents section of the HMIS, and then you request of the Coordinated Assessment Office for documentation. We'll follow that process. It'll have a new form. It'll just indicate what the priority level is and any notes if there is something distinguishable about that client pending on the information that was submitted by the agency. And remember, the changes had to do with the HUD notice that came out this summer. This notice came out after we had already established the P3 system, and so that's where the resource is. The client is going to be assigned a priority status level, calling it the P12 system. Priorities 1 through 8 are very specific and based on the recommendations in that notice. The balance are based on a lower level severity of service needs because the chronic permanent supportive housing beds and the non-dedicated chronic permanent supportive housing beds as a continuum of care, we have indicated that those beds available, at least 85% of them will be dedicated to persons who are chronic. Excuse me, I had to get a drink of water there. The other levels, P12, give us an idea of level of service needs for families and individuals, a priority to families, a priority to persons who present with levels of service need, and then no priority essentially means someone who's only been homeless a few days and may have any certain level of severity of service needs, or those that are just at risk of homelessness. And so that remember, in your documentation of homelessness documents, there's one that says homeless definition and walks you through the 4 categories. There's also an at-risk of homelessness category, and those are primarily used in providing information to decide those that are eligible for homeless prevention resources, such as those provided by the SSVF grant for veterans or emergency solutions grants. So I'm going to skip out here and go show you what that new prioritization matrix looks like. And this has been updated, and it is on the TCHC website, and I'll also email it out with this PowerPoint presentation. I want you to, right at the beginning, I want you to know that this is a guideline. The ones that are most strongly held are P1 through P8 because those are based on a HUD system. It has to do with the homeless category, chronic homelessness, and those that are not chronic but present with a high level severity need. So it has to do with, did they meet the definition, the homeless category, based on the HUD definitions? The next column, length of stay in homelessness. There's a lot of iterations there. That is why when case managers request of the Coordinated Assessment Office, they request of Mario, a lot of them get kicked back because you have to make sure that if there is a portion of the homelessness that requires an affidavit, it has to be very specific Documentation of homelessness is easiest and best within the HMIS system. Records of unsheltered homelessness, there's a reason why there are very specific details, because it is very specific to the notice. And if you're not sure exactly those category, you can go read the notice. I think it is also on the HUD website, and we can put that on the TCHC website. So there is a reason why things are very articulate and very specific, because those beds need to be allocated per the COC policy so that they meet any HUD monitoring level. And that's why we go through and we are very specific about the dates, and the dates of an affidavit should match, the dates within the HMIS should match the history of that client's homelessness. Where they're experiencing homelessness, as it would be documented in the HMIS. And this is the new column, the severity of service needs. The policy was high and low, and that we would use the VI-SPDAT. The standard in the VI-SPDAT says that a person who is deemed to have the highest level of severity of service needs would have a score of 10 or greater. A disability must be documented. That's the last column. And so low means lower level, because a lowest level would be 0 to 4. A low level would be anywhere from 5 or greater. Mostly it would be 5 to 9, but you may remember that anyone of any higher degree, we're talking about the allocation of a housing resource. It's not absolute. It is within these categories. We want to make sure that those persons with the highest level severity of service needs get those higher level programs that cost a lot, involve integrated case management and other health services. And so this gives you an idea. So when Mario will receive a request from someone, he's going to review the record in the HMIS system. He's going to look at the length of stay in homelessness, the affidavits, and make sure they're there. He's going to be looking for exactly where the client had been, especially the institutions. You have to make sure that they can't be institutionalized. There's a 90-day rule to meet those definitions. He's going to look at the HAF score that you completed and look at the number of that score and look to see if there's any documentation of disability. So those most precious permanent supportive housing beds you're going to see, which would include Directions Home and Continuum Care PSH beds, are going to have a high degree of scrutiny in the documentation. Now as we move down, because we've got a lot of rapid rehousing, we still have transitional housing within our community. You can see that those are going to have a lower VI-SPDAT score of a 5 or greater. These are still primarily going to involve families that present with multiple barriers. They're going to need some subsidy. They're going to need case management, and they could be needing subsidy and case management for 3 months, for 6 months, or perhaps even longer. They don't absolutely require that you document disability, but if it's available, that it would also probably be consistent with someone, a family that, or an individual that has a high level of service needs. And then we have this non-priority 1 and non-priority 2. This primarily means there's 2 different definitions. There's homeless category 2, that's at risk, and if you they're going to lose their house within 14 days, or that they have a length of stay of less than 14 days. It was also very important that for a family, any length of stay was sufficient to be considered for rapid rehousing. But for an individual, we know from our data that individuals who fall into homelessness need time to see if they can self-resolve before we provide a full subsidy and resource. We want the process to work. Those are going to be the numbers that we're going to operate on probably for the next 6 months or a year, and then we will compare that to the actual experience in our community of where we are in length of stay. If it looks like that we have lengths of stays that are not reducing, and that persons with lower lengths of stay are taking housing subsidies over persons with longer lengths of stays, we may, as a continuum care board, present that data and modify some of the lengths of stay categories from priority 9, 10, 11, and 12 to make sure that we're addressing those persons with the highest level of needs or the most episodic of homeless circumstances in our very vulnerable families. Non-priority 2, this is at risk. Now, some persons who are being served perhaps through homeless prevention programs at Tarrant County Human Services, those don't necessarily depending if the ESG funded programs will need to go through the HAF process. Other types of homeless prevention resources may not be this, but those that are continuing care funded and emergency solutions grant funded should go through this process. And you'll notice that, and I'm going to go back to this, it's or greater. Though the guideline may be 5 to 9 for some of these, where you can see where my mouse is going where it says low, it could be greater, because in effect persons who present with a high level of service need still, there may be multiple resources available. They may have the advantage of a full SSI, SSDI check. They may have some supports in the community that we can use some of the lower intense services to house them, not necessarily have to wait for a permanent supported housing bed to be available. So that kind of gives you an idea, and this is available on the website. So where does this score present? Where it always has. You will see on the clients, as you're encountering clients, always check the dashboard to see if they have already had a prioritization completed for them. And you'll also see the date. That's going to be important as we attrition to the new system for those individuals that are still unhoused, and it's been more than 90 days. We're going to want to update those. And so this is where it would be posted. And all this information will also be, of course, documented in the HMIS for monitoring. The next step is that all these individuals that have been gone through the prioritization system and have been had adopts, a documentation priority status completed, they show up on a housing wait list. And if you all have not, anyone in your staff is involved in housing individuals or seeking housing for individuals, they want to be a part of this priority housing wait list. I just changed the name of it today because it's not just priority 1. And so this is a centralized location that is secure. This list is updated weekly, and it gives you an idea of who's priority 1, who is priority 2, and on down the list, so that there is a push or pull. If your agency provides permanent supported housing, you have 2 vacancies, you're going to go to the base camp list and go find individuals that have already, in effect, are document ready to be housed. This is to help us to do 2 things. Demonstrate that we are giving housing to those persons with the highest level of severity of service needs, and also allowing you all to quickly house someone, and you're never starting from scratch. That we have, this process has already been managed. Now, how do we match this together? I have put together a simple matrix based on the housing inventory chart. This is an example. This is a first draft. This matrix is going to change based on communications with the coordinated assessment system contacts at each agency. So let me blow this up. Essentially what we're looking at is we have these different project types, different housing types: permanent supported housing, safe haven, rapid rehousing, transitional housing. We have the organization who provides the service and the project name. Some of them are dedicated for certain subpopulations. Here we have veterans that are VA eligible. This one down here, they take veterans that are ineligible for VA services, families, different dedicated projects. And across the top, you see priority 1, 2, going all the way to 12. So in effect, someone who is a priority 1, a chronically homeless individual, there are essentially any housing option might be available to them if it is deemed appropriate and they are eligible. And as the lower your prioritization, the lower your severity of service need, the fewer options that are available within our housing subsidy programs. This is not comprehensive yet. I need to put in Healthy Community Collaborative. We need to review this for the housing resources we have, and so this gives an idea, a guideline of a recommendation of housing type, working in collaboration with the HAF report of trying to see, I've got the prioritization level, this is where I think that I might be able to find housing resources and where they're eligible. And it's, again, it is a way of distributing the demand of the housing that we have available with the needs of the clients in the system. Okay, when To manage the supply of housing, the Coordinated Assessment Office should be the first to know if there are housing openings. We're almost through the modification of the housing inventory that was on the TCHC website. The WordPress system that holds our data, our website, is actually going to be upgraded tonight, I believe, so it's going to be offline for 24 hours. And then on the member side, this is where we're going to keep track of some of those housing openings. Again, this will need to be communicated through your Coordinated Assessment System contact. COC, Continuum of Care Program, Emergency Solutions Grant, Directions Home, and Health and Community Collaborative Fund Housing need to secure adopts for allocation of a housing voucher or resource. This has pretty much been the practice now, but this is going to expand to all COC programs, all COC funded programs, Housing Solutions, Recovery Resource, the variety of TBLA programs. All those programs must secure adopts. So in order to get adopts, you have to go through the housing assessment form, get your score, email the Coordinated Assessment Office, email Mario, request adopts. He'll produce the adopts, and it'll be uploaded into the HMIS system, and they will be emailed that is complete before they allocate a resource. So if you have if Housing Solutions has a bed available, they've had a turnover, they've already, within Presbyterian Night Shelter, have dozens and dozens of their own clients already prioritized, and they can go straight to prioritizing anyone, the priority 1, priority 2, 3, or 4. This is, again, just sort of push or pull from housing. All clients should come off of the housing list. The confirmation that the CAS office and the DOTS process is being followed will be managed through desktop monitoring. Remember that the HAF and the DOTS process is a way of making sure that your clients are eligible, document ready, in collaboration with coordinated assessment, which has become a requirement of many of the housing programs in the continuum of care. We can simply, from a desktop, be able to pull any new clients that have been new enrollees over a month, and we would easily be able to see what their prioritization number. If there are any clients that, let's say, will be enrolled in January, and we pull the report and we don't see a priority number next to that client, we know that someone has housed them through a side door, and we may have to ask how that happened. Was it someone who had been committed to that housing prior to December 17th or not? Those are the things they're going to be looking for. So you can monitor yourself and just make sure that you have got that prioritization secured, documented in HMIS prior to housing. So beginning today, new enrollees into housing programs should have a prioritization score on the client dashboard, the prioritization number 1 through 12. So here's some questions, and then we'll open it up so you can, I'm going to let Carolyn make sure that everyone has the capacity to chat on the GoToWebinar. What about the previously prioritized clients? We've been doing this since April. The unhoused clients, those that haven't been assigned a voucher, haven't been enrolled in a program, on the priority list should be reprioritized after 90 days. And there are several I know already on the base camp list that were prioritized in May and June, still have not been housed, and they're going to need to go through this process, through attrition. And so likely within 90 days from now, everything will have been updated because we have that 90-day rule. What about existing internal agency housing wait list? Those of you who are receiving continued care funding, Directions Home, you shouldn't have an internal housing waiting list. That should have gone away. But if it hasn't, you need to take those persons on your waiting list, make sure they're DOPSed, and you need to operate off the one centralized continuum of care priority housing list. For our continuum of care policies and procedures that we are passed, that is the master waiting list for the continuum of care for permanent supportive housing and transitional housing, and for many programs, the rapid rehousing. Until we take care of the backlog and working with our families, we have to make sure that we have that prioritization list. Having said that, for rapid rehousing, our Learning Collaborative will start next year on January 29th. We were going to have a planning session yesterday, but I was out sick and I apologize. But we will have that process in January, where we're going to see how best this coordinated assessment system and DOPS and HAF system is working for families who need to be rapidly rehoused. We need to walk through that system as a community, make sure that we're checking the boxes, but we're not letting the system be a barrier to rapidly rehousing. So note that will happen next year. So you need to be working off the priority housing wait list that's on Basecamp. So what about clients that are already in the process of seeking housing? Clients that are already enrolled and maybe searching for housing or they've got a voucher, you're grandfathered in. So we know that anyone that was enrolled in a program today, December 17th or prior, that you're grandfathered in and you're in the process of being housed. So it's anyone that is new to the system beginning tomorrow. Those we should make sure that you go through the HAF process. Now, Safe Haven also has rapid rehousing, transitional housing, and purpose-for housing programs. They need to meet essentially the same thresholds of that P12 list, but they're going to be on paper. We will be working with them to make sure that they can demonstrate that they are taking individuals with the highest level severity of service needs. The VI-SPDAT is available in paper form, and we will make sure that that is communicated to them, and they have to follow the same eligibility criteria as any other program. They're just not going to be necessarily within the HMIS. Within the HAF, if a case manager in an emergency shelter is interviewing an individual or a family or the adult head of household, and they present with multiple responses related to current domestic violence, there's already a referral mechanism in there, and that will continue to be followed to make sure that those clients can be immediately referred. But you can still have that score, and then that can be conveyed through email, through telephone conversation, that the person is being referred because of a high level severity service need presenting with DV issues. So there shouldn't be any problem in causing any barriers with those clients that present with DV issues. Now, what about rapid housing clients? I've talked about that before, that yes, the continuum care and ESG resources should follow the same process. The rapid rehousing programs funded through the ESG grants and funded through continuum care should go through the HAF process and get that score to make sure primarily that for some clients there may be a lot more service needs, that if there is a one of the transitional housing programs may be there, or just which agency providing rapid rehousing would be the best fit. So we want to make sure still that it's not just about bed availability, and different agencies provide a different array of services within their rapid rehousing, and there may be a best fit. It may be the Healthy Community Collaborative is a much better fit than a YWCA family rapid rehousing because of severity of service needs and the type of needs of the client. So we want to make sure that all of the rapid rehousing clients follow the DOPS process. The same as with permanent supportive housing. Rapid rehousing is considered a form of permanent housing. So I mentioned before that the Coordinated Assessment Office is through its first year, our first developmental year. On Tuesday, January 27th, 8:30 in the morning to 3:30, we're going to do a full day. It's called a CARES model. We're going to walk through the existing system that we have developed, and we'll have undergone a good month of the HAF process, and we're going to attack some of the issues, some of the barriers, make sure that the process is working, the paper flow is working for agencies. And so we want program managers, frontline workers will all be invited to attend that full day training as we as a community walk through the system as it stands now, the prioritization, the HAF, the base camp, the wait list, and walk through from a client's perspective how it's working. And if we need to make recommendations to the Planning Council or the COC Board to modify any policies and procedures, we'll consider that. Every new system has its hiccups and its bumps. We want to make sure that it's compliant, but that it works for the client and from the client's perspective. So save the date, and we are going to get an invitation out. So I wanted to give this opportunity now. If anyone has a comment or a question, that they can type it in the chat function. If you're on the phone and not on front of your computer, you can of course email me directly or Rebecca any questions in regard to this. So if anyone has any questions, if they want to go ahead, let me make sure that I have the option. Attendees can chat. There you go. I think I had you unchattable. So I'm going to look at it in a few minutes to see if there's any other questions. I'm silent because I'm reading. I don't see anything popping up. Okay, well, there's one. Is the HAF and SPDAT the same? Yes, and let's go back and go back to my presentation here. When you look at it in the system, let me go to one of those wonderful Alexandra screenshots. When you open up the HAF Touchpoint, it literally looks like this. The very first, when you conduct the touchpoint, the VI-SPDAT touchpoint in ETO, it'll literally open up like this, and here's your workflow. So you're going to first start with those VI-SPDAT questions that were not already pre-populated, and then it'll at the end of this, it'll hit next, and then you'll hit the housing assessment form, and then you'll skip unaccompanied youth, and then go to the report. So it's all in there. HUD. Another question is about the HUD intake. Now, it depends on where your client is. Emergency shelters do an intake when either the Day Resource Center or TCHC staff do the HMIS card. So someone has presented an emergency shelter, we do a HUD intake, but emergency shelter beds are in and out in one day. Presbyterian Night Shelter, for example, and also the Salvation Army, they have a second-tier level of emergency shelter programming, just like Arlington Night Shelter, other than just staying overnight. It's moving home, or the START program, and they literally will have those emergency shelter clients enrolled. They will enroll them in START. They will enroll them in moving home, and that enrollment indicates that they are in a longer-term emergency shelter program. That's a HUD intake assessment. So if in SOS, for example, unsheltered, if you're enrolling a client who said that they have agreed that they want to participate in case management unsheltered, you would enroll them into your street outreach program. Now, some of the agencies don't have a program to enroll them in, and we have created in those agencies, in your pull-down menu of programs, something called CAS. That gives you a place to do a complete HUD intake assessment. They're not going to show up in the point in time count. They're not going to show, but it's going to allow you to get all of that demographic information in the system. You can enroll people in CAS. You don't have to worry about exiting them. That gives you a place within your system, within your agency site, to enroll a client, and that gives you the demographics. So you might enroll them in CAS, ask them those questions, and then conduct a VI-SPDAT HAF Touchpoint to get the score. Okay, I'm looking through the questions here. What does the VI-SPDAT stand for? I don't know. Vulnerability Index and SPDAT. You'll have to go look that up at those two websites that I mentioned in the system that you could probably go find that out, and then you will be smarter than I did used to know. There, go one of these two websites right here, and you will be able to look it up. Okay. Where will the presentation be archived? Our website, and it will be literally on go to the TCHU website, ahomewithhope.org, and you can either search engine coordinated assessment. Also within this PowerPoint presentation, I will email it out, and those links are embedded in the PowerPoint, but it's on the TCHE website. And the next, do you recommend that homeless preference applicants go through the DOPS HAF process? This has to do with what we had for the first time in our housing inventory chart that was done in January 2014. HUD gave communities the opportunity to put OPH, and you'll see, or would see, on our Continuum of Care's housing inventory chart, housing called OPH, Other Permanent Housing. This was added so that public housing authorities that took HCV, Section 8 vouchers, and said that they would dedicate them to persons experiencing homelessness, that they would be included, because this might be an option for maybe a formerly chronic person who is now completely stable, but is elderly and will only have a very, very limited income, that they might be able to move up into the stabilized housing because they don't require the extensive monthly case management. And recommending using the HAF, if it could, if you had a long-term homeless person, elderly, limited income, I think that what we can do is that we need to consider on the P12 matrix and on the housing inventory chart guideline, and I'm going to pull up that document, that if we include other permanent housing in this project type, that we coordinate and make sure that it is consistent with the agency plan and the types of individuals that want to be in that housing, and we may have to add that to this so that there could be a structured recommendation. The value of the prioritization HAF system may be that there will be the documentation this person that may be considered to populate another permanent housing HCV voucher, dedicated HCV for homeless, had a documented homelessness within the system, and it might help with the eligibility and to make sure that it's whatever the housing intervention is, that it's appropriate to the client. So we can work that and then let the permanent housing, the public housing authorities, Arlington Housing Authority and the City of Fort Worth, that their Fort Worth Housing Authority will work with them so that the path and the intake and referral process is known to everyone. I've got a question specific to street outreach. Because street outreach is actually funded by a portion of the evening is funded under ESG, that you would want to absolutely enroll those clients so that the demographic information is noted just for ESG reporting, and that if there is a housing referral, using the HAF and using the DOPS process is the only way to get unsheltered clients on the housing wait list. So there's obviously going to be some intervention that the client has to know that their name is going to go on a housing list so that they can be on a housing list, especially if they're unsheltered and especially if they present with a high level of severity of service needs. This is how we get them housing. So that especially unsheltered homeless who are willing need to go in this process to get on the list for housing. We have a very smart follower. The VI-SPDAT is the Vulnerability Index. I got that right. Service Prioritization Decision Assistance Tool. And again, it's just a tool. It's a pre-screen. It's one tool of many. Directions Home. I have a question about Directions Home housing placement. Now, housing placement, I know that they get scores and for persons when they house persons outside of maybe existing permanent supportive housing. It depends on where you're placing them in housing. Enrolling them in the program, doing a HAF and a DOPS process may be used as, just like the VI-SPDAT says, as an assistance tool to determine what might be a more appropriate level of housing, because you may, oftentimes some of those housing placements may be nursing homes or assisted living or just affordable housing. It doesn't hurt to do the DOPS process. Is it a required of housing placement? I don't think so. I think under the policies and procedures of Directions Home housing placement, they want to make sure that A, they were homeless, there's a documentation that they were homeless, and then after housing they don't return to emergency shelter. So I don't know that it can help you in trying to place someone in housing, so I would not do it, but I don't know that it's a Directions Home requirement to see that. And I think I've answered all the questions. Again, if you think of some more stuff, and especially as we implement the process, then just continue to ask questions and save those questions and those experiences and examples for that January 27th date. There's so much going on in January, but we've got to keep working. And that will give us an opportunity to look at the experience, look at the data, look at the numbers and see what's going on and fine-tune it and give it a good quarter to 2 quarters before we think of substantive policies and procedural changes based on our experience, unless, of course, something is truly broken and not working and becoming a barrier to housing clients. Those, we can troubleshoot those on the fly, but overarching policies and procedures, meaning those definitions within that P1 through P12 chart of definitions, that would be have to be decided upon the COC Board of Directors and a policy and procedure, and the Planning Council is kind of our touchstone for that Rebecca Cox manages to know whether or not things are just not happening and people are being stuck. One of the issues that could happen is that we have to have a mechanism to say, how do we make sure that the P1, 2s, 3s, and 4s are getting housed over the 5, 6, 7, and 8s? How do we make sure that? Well, that's going to have to be done at the TCHC monitoring level. We've got to make sure when we look and see that there are some persons who have been on the base camp list far longer than 90 days and persons that were less were housed first, we may have to roll up our sleeves and look at that from a policy and say that we need to have the priority ones need to be taken care of before those with lower priorities, especially with COC-funded permanent supportive housing beds. There are different eligibility requirements, such as Arlington Housing Authority is going to serve clients that are in Arlington, so that makes good sense. Some of the Fort Worth Housing Authority Shelter Plus Care are for persons who may often present within that jurisdiction. So there's going to be some other eligibility variables. We will just do it merely by monitoring the process. And I think that's everything. We check one more and see if there's any new questions, and there are not. Okay, thank you. This was a 1-hour broadcast, and I appreciate your patience, and I'm glad my voice held out. Ask any questions, and this is going to get printed to PDF and maintained in the PowerPoint format, and we'll get it posted on the TCHC website within the hour. Thank you.